Travel insurance is super cheap. It's the best. Public health insurance pays for my kids and my spouse as well. It's way better. Private insurance is the best. It gets me the fastest appointments. But you can never get out of it anymore, and when you're old, the premium will explode. There's no topic in personal finance where I see more misconceptions than when it comes to German health insurance. So let's get things straight today and speak about facts rather than myths and lies. Because our health is the most important topic of all. So this is the most important insurance of all. But which system is better, public or private? And which system is better for you? And how am I personally insured? If you want to find the right decision for yourself and your health, all you need to do is watch this video. What's up everyone? Welcome to a new video from Perfinex, the #1 financial planner for expats living in Germany. We believe that financial education leads to financial success. That's why we upload easy to understand videos on all topics of personal finance every single week. And since there's no better time to take care of your financial future than right now, subscribe to our channel and reach out on WhatsApp if you have a personal question. We're here to help. Over the last weeks, we spoke about how to read your payslip, the income tax you have to pay, the German social security system, our pension system. So all that's left for today is health insurance. Our German healthcare system is divided into two systems, public and private. I know there's also these travel insurances that may be alright if you are a student or if you just come to Germany. But as soon as you decide to stay here in Germany for a while, it's time to get a proper health insurance. Why? Because it's mandatory in Germany. Everyone living here needs health insurance, public or private. And this decision is a big one, with far-reaching effects. To help you make the decision that is right for you, let's look at what service you get, followed by what you have to pay. And this is also how you should choose. Please don't make this a solely financial decision. Your health is more important than that. And after clearing the two biggest myths, I'll tell you how I am insured. There's a little over 100 public health insurances in Germany, all basically having the same kind of benefits. There's just very minor differences. Why are the benefits all the same? Because the government makes the rules. Our social security law determines how much you have to pay for health insurance, for public pension, and also what kind of benefits you get. If you want to know more about social security benefits, check right here. The big problem I see with this is that the government continuously decreases the benefits while increasing the premium. But more about the costs later. Over time, members of the public health insurance have been forced to pay at least partly for their own medication, for their own dental treatments, and for their own glasses. Now, why would government employees decrease their own health benefits? Makes no sense, right? Well, they don't. Plot twist is that almost all government employees are a member of the private health insurance. And in the private system, all benefits are guaranteed and cannot be decreased. It's a private contract between you and the company. So as long as you fulfill your obligation of paying the premium, the insurance will fulfill its obligation of guaranteeing you the benefits. And you can choose the level of benefits you want to have yourself. German health insurance consists actually of 3 different parts: ambulatory for doctors, stationary for hospitals, and dental for dentists. You can imagine the benefits with stars like hotels from 1 to 5. In the private health insurance, you can choose your benefits in all 3 different parts yourself. If you want the best benefits, you have to pay, of course. The star level of the public health insurance is fixed by our social security law at 1 star. If you don't like it, you can get private additive insurances on top of your public health insurance. There's private additive insurance for all 3 parts of health insurance available that can lift you up to the 5-star level. So if you are not eligible to switch to the private system, and we'll come to this in a minute, you can at least close the gap on a benefit level. Other benefits, like free choice of doctor or hospital, you cannot get as a member of the public system. Like, you have to go to the closest doctor or hospital that is accepted by the public health insurance. And some doctors just choose not to work with the public health insurance. Why? Because a doctor or a hospital are a business, and they get more from treating private patients than treating public patients. That's also why members of the private health insurance get an appointment the next day if they want, and members of the public health insurance have to wait sometimes weeks or months. I'm not saying that's good or bad, it's just facts. It's how the world works. Neither you or me are gonna change the system. We just have to find the right place inside the healthcare system for us. Unfortunately, not everyone is free to choose if he wants to be public or private. If you earn less than 62,500 euro gross in 2020 or less than 64,350 euro gross in 2021, you are forced to be a member of the public health insurance. Employees earning more or self-employed people have the freedom to choose if they want to be a member of the public system or the private system. Members of the public health insurance have to pay 14.6% of their income, most likely your gross salary, as premium. So the more you earn, the more health insurance you have to pay. But everyone gets the same level of benefits. On top of that, every public health insurance charges an additional contribution that ranges between 0.3% to 1.5% depending on their efficiency. So if you earn 56,250 euro gross or more, you have to pay the maximum contribution of 698 euro in the most efficient and 755 euro in the least efficient public health insurance per month. On the bright side, your spouse and your children may be insured for free if none of them are working. The private health insurance, on the other hand, is not bound to your income. Your premium is calculated based on the benefits you want. The higher the star level, the higher the premium. Your health status, the more healthy you are, the cheaper it is. And your age, the younger, the cheaper, of course. Does that mean your premium will explode when you're old? We'll come to the myths in a minute. One last addition, of course you only need one health insurance, public or private. And of course your employer is paying half of your premium, doesn't matter if you're public or private. Alright, now that we've covered benefits and costs, let's clear some myths. Myth number 1, private is cheap when you're young, and when you're old, you can't afford the premium anymore. Okay, first let's come to what's true. Private is really cheap when you are young and healthy. So for every one of you who's here in Germany working for just a couple of years and plans to leave again, you can save a lot of money by switching to the private system. Now let's get to the premium when you're old. Does the premium of the private health insurance increase over time? Yes. Does the premium of the public health insurance increase over time? Also yes. The government just hides it very well. Here's what IGES, an independent research institute, found out in a study in 2017. From 1997 to 2015, the private premiums increased by 3.3% per year, while the public health insurance increased only 2.6% per year. So over 20 years, public won by 0.7%. And over the last 10 years, private increased by only 2.2% per year and public by 3.7% per year. So in the shorter time frame, private won by 1.5%. As you can see, both get more expensive over time. That's what we know for sure. Which system will increase more in the future? I can see into the future, even though you guys seem to think every once in a while that I can. By the way, my oldest client, who is a member of the private health insurance, is 81, and not even he is paying more in private than he would in public, especially with all the private additives he would need in order to get to the same star level. How is that possible, you might ask? Every member in the private health insurance saves at least 10% of his premium for retirement, and all these savings will keep your premium from exploding. Myth number 2, once private, always private. This is just a straight up lie, and I got the German law to back it up that it's not true. There's just very strict rules when it comes to health insurance. So you can't just switch to private because you feel like it, and you can't also switch back to public because you feel like it. I also haven't met anybody who wanted to go back to public health insurance after enjoying the benefits of the private health insurance. I mean, you had a very good health insurance with the best coverage throughout all your working life, and then when you're old, you want to go back to public? I mean, really? That's the time when you need it the most. But okay, if anyone out there wants to go back from private health insurance to public health insurance, here's how you do it. Go to your employer and tell them you want to use your legal right for Brückenteilzeit according to paragraph 9a TZBFG, basically temporary part-time. Then you will probably own below the threshold of 62,500 euro gross per year and are therefore automatically forced to be a member of the public health insurance. Again, not sure why anybody would want to do this, because you will lose all your seniority savings and that would be pretty stupid, but whatever. Myth debunked. The problem is, and that's also the reason why these myths exist, nobody is looking at the German law or at objectively true facts and numbers. Everyone is just spreading random things they heard somewhere and think they're true. Especially all your expat friends or random people in Facebook groups or on Reddit who don't speak a single word German. Now, I'm not saying anything bad about your friends or random people on the internet. They're probably good people. They're just not the right person to discuss your health insurance with, as are public health insurance salesmen, because they will tell you public is better. Like private insurance salesmen will tell you private is better. At least speak to both of them to get a more complete picture. Or talk to us. We're here to help. Your health is more important than anything else. We know this. In these times of the pandemic right now, it's more true than ever. So hopefully this video helped you to find the right system for you. Let me know in the comments if there are still questions unanswered. So how am I personally insured? I've been born a member in the public system, and as soon as I was allowed to switch, I became a member of the private system. Because I want to choose the coverage I get today and in the future, not the government. I decide what benefits I want, and if I get really sick, I want the best service I can get from the doctor or hospital that I choose myself. My health, my choice.